Fox 13 investigates after a whistleblower reached out to us. Fox 13 reporter Winnie Wright alleging malpractice at one of the largest veteran centers in the country. That whistleblower says patient appointments at an Arkansas VA hospital were intentionally deleted to make a quota, putting the lives of Mid-South veterans at risk. Winnie has been aggressively working this story, pressing for answers for almost 2 years. She is here now with why the whistleblower came forward and why they say the public needs to know what's going on.
The whistleblower lives in a constant state of fear. For years, he worried he'd be fired for reporting what he saw and later for reaching out to me. He recently retired, but now he fears he could lose his benefits. The risk, though, he says, is worth it because otherwise he fears nothing will ever be done to right an unforgivable wrong. Veterans seeking care instead turned away for personal gain.
Why now? Why come forward with this information now?
Because the management that was in charge of this is still there, and potentially these same actions are being carried out on a daily basis.
Our whistleblower was an employee at Central Arkansas Veterans Healthcare System for decades. In the early 2000s, he alleges, things hit rock bottom.
The chief PT at the Little Rock VA, CAVHS, ordered and demanded that numerous therapists go into doctor's orders and patient consults and discontinue them using the words administrative cleanup.
According to publicly available documents, several CAVHS employees reported that same manager, Robin Atkins, forced them to delete patient consults between 2000 and 2005.
She would curse and shout and threaten people with their job performance and ultimately their employment.
Atkins never replied to our multiple requests for comment. Instead, a hospital spokesperson told us they wouldn't be able to comment unless we gave up the whistleblower. We told them that wouldn't be happening and reminded them the information was submitted to the VA directly. In 2014, a newspaper uncovered a secret wait list at the Phoenix VA. A whistleblower reported delayed appointments resulting in veteran deaths. Investigators found the motivation was financial. VA officials could have missed bonuses for short wait times.
It's my understanding at the Phoenix VA they did alter patient data for personal gain, but that was done by rescheduling appointments. So those patients were finally seen. In our case, these were discontinued and thousands of veterans went without their care.
Several whistleblowers gave me copies of complaints filed with CAVHS, Congressman French Hill's office, and the VA Office of Accountability, an office created specifically to address issues after the Phoenix VA scandal. They include allegations about canceled appointments in several departments. There, I found the name of a veteran who worked at CAVHS. I spoke with the veteran, worried about retaliation for months about his appointments canceled without explanation. When I called him for a scheduled phone interview,
please leave your message for...
He didn't pick up. As he told me and is confirmed in the whistleblower reports, another VA employee asked why he canceled his appointments. The veteran explained he hadn't and asked primary care why his appointments were marked as no-show. In tears, the clerk confessed her supervisor told her to mark the appointments as canceled or their performance would be rated inferior. Do you believe this level of corruption goes all the way to the top of the VA hospital?
Yes, without a doubt. The Office of Accountability is involved. They didn't take action for 2 years. The director's office, the chief of staff's office, they all have knowledge of this. No one looked at the electronic data that proves that this event did occur and potentially is going on today.
The whistleblower fears if a situation like this could happen in Little Rock, it could happen anywhere.
We're well rated and everything else.
Dr. Stephen Forbush, an associate professor of physical therapy at University of Central Arkansas, says the consequences for these veterans could be dire.
If they're not functional, not moving well, they're going to have a lot more disabilities, they're going to have a lot more issues, and they're going to be paying for a lot longer care and more surgeries and more MRIs and more everything else in the long run.
CAVHS would not interview with us on camera, but sent us a statement. It reads in part, quote, allegations from employees concerning patient appointment scheduling have been reviewed by both CAVHS leadership and the Office of Accountability and Whistleblower Protection and found to have no merit. Our whistleblower says it took 2 years for investigators to come knocking.
Finally, some representatives asked some questions, but the local VA was allowed to investigate themselves. Essentially, the bank robbers were allowed to investigate the bank robbery.
Congressman Hill's office had no comment on the delays, and my attempt to get records about constituent complaints was answered with a letter from the General Counsel for the U.S. House that stated Congress is not subject to the Freedom of Information Act. Meanwhile, those allegedly responsible, including Atkins, still work at CAVHS.
Ultimately, it could have cost lives, veterans' lives. It's a tragedy.
After waiting 8 months, the VA told me it had no records responsive to my request about the investigation conducted by the Office of Accountability and Whistleblower Protection. When I pushed back, I got a call from a very senior member of the OAWP. He pointed me to an Inspector General report, telling me it should answer most of my questions. In part 2 of my investigation, I'll show you why that report says whistleblower complaints about botched investigations are not out of the ordinary. That story tomorrow night on Fox 13 News at 9.